While most bites can only itch, others can be extremely dangerous and cause a huge number of health problems, if not immediately noticed. These important first aid rules can save your life or someone else's. In most cases, the bite of a hornet, wasp, bee, or bumblebee is not dangerous, although it hurts. But in about 2% of victims, it causes a powerful allergic reaction, which can quickly lead to death. The fact is that the venom of bees, wasps and their relatives contains many biologically active substances that provoke. If you are unlucky and your immunity is particularly aggressive against this type of toxin, the risk increases. However, in order to suffer greatly after meeting wasps or bees, sometimes you don't even have to be allergic. It is enough to run into a swarm of these insects. To get a lethal dose of poison, a healthy non-allergic person needs 500 bites, about 0.2 grams. But usually a toxic reaction of one strength or another occurs after 5. If you know you have an allergy to an insect bite, be sure to take your allergy medicine with you when you walk. It is very important to observe the victim for the first few minutes after the bite. Some people can help themselves at home, but not all bite heals so easily. There are people who are allergic to poison and may develop an anaphylactic shock. To reduce discomfort, wash the bite with soap and water. Apply a cold compress to the bite. An ice pack wrapped in a thin cloth, a metal spoon, a cloth soaked in ice water. Let it sit for 15 to 20 minutes. Carefully, this is important. Remove the sting, if present. For example, wrap a piece of gauze around your finger and, using stroking, pushing movements, make the pity come out from under the skin. To relieve itching, apply a 2:1 mixture of baking soda and water to the bite site. Itching after the bite lasts up to 3 days. It is important to remove toxins from the body as soon as possible. For this purpose, it is recommended to give the victim a strong tea with added sugar to drink. In the absence of such an opportunity, you must give at least 1 liter of liquid to drink. Pull out the sting roughly. There is a bag of poison in the sting of the bee, and when pressed, the poison can get inside and worsen the effects of the sting. Comb the bite site. This will only increase the swelling and itching, and infection can get into the wound. Alcohol consumption. This remedy only accelerates the spread of poison throughout the body and prevents the identification of symptoms that an allergy has arisen from the bite. Treating the wound with raw water, clay or earth is a direct way to infection of the wound. Destruction, swatting, of a stung individual at the time of death. Insects secrete a special enzyme that enhances the effect of the poison and is a signal for other individuals to attack. The imposition of a tourniquet on the injured limb after an insect bite. It is important to be able to recognize an anaphylactic reaction. In some cases, this can save a life, yours or that of a person nearby.
These signs indicate that life is at risk: shortness of breath or wheezing, sudden hoarseness or trouble speaking, feeling as if it is impossible to inhale, as if the airways are closing, too large, more than 5 centimeters in diameter, swelling from a bite in the face or tongue, a bee bit in the neck, stinging from the inside of the throat. This happens if by accident, for example, with a drink. The victim is a child under the age of 5. There are severe chronic diseases, especially of an immunological nature. If the previous time there was already an acute allergic reaction to a bee sting, the reaction only increases with each subsequent time. There is a rapid deterioration in the patient's condition.
Do not hesitate to call emergency help. Most deaths from allergic reactions to insect poisons occur within the first hour after the bite. But it is necessary to observe the stung for 3 hours in order to notice the appearance of threatening symptoms. How to help a victim while an ambulance is traveling. Ask the stung if he has an adrenaline auto-injector. If a person is allergic, this device can be with him. The drug should be injected into the outer thigh. Do not inject into a vein, gluteus muscle, legs below the knee, or arms, as this can damage tissue. Several injections may be needed. If after 10 to 15 minutes the condition does not improve and breathing difficulties, nausea, weakness persist, help the victim inject adrenaline again. Despite the squeak emitted by the insect during flight, most often the very moment of the bite remains unnoticed. After only a few minutes, a mosquito bite manifests itself as itching at the site of the lesion, swelling at the site of the lesion, redness at the site of the bite. Outwardly, the bite looks like a small red blister with the most intense color in the center. There is no poison in the saliva of a mosquito, and it is Post-bite instructions do not comb the bite site under any circumstances infection may occur. Our hands, and especially the areas under our nails, are known to carry germs and bacteria. By scratching the bite site, you damage the skin, thus increasing the likelihood of germs and bacteria entering the skin. Wash the bite site with baby or laundry soap. Apply an ice pack or cloth soaked in cold water to relieve swelling from a mosquito bite. To get rid of itching and redness after mosquito bites, you can use a remedy purchased at a pharmacy or improvised, prepared at home.